Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Welcome to our presentation on Medicine Sans Frontiers, more commonly known as MSF. We are ANEI Consulting Corporation, and today we would like to take you on a journey behind the scenes of this remarkable non-profit NGO.
Assalamualaikum and hi, I'm Azrul, serving as the manager. Supporting me are my consultants. The first one is Iman, our operation consultant. The next one is Izzat, our senior consultant, and Nasri, our management consultant. Together we formed a team specializing in strategy, operation and organization improvement.
So, here's the flow of our presentation. First of all, we will look at the background facts of MSF. Then, we'll move to the decision making, followed by leadership in MSF. Next, we'll cover the management trend and issue faced by our organization. And finally, we'll wrap up with our conclusion. This will guide our presentation today.
So now, let us get into the background facts of MSF. But before that, what is actually MSF? Medical Sans Frontiers, or known as Doctors Without Borders, in short MSF, is an international non-profit organization that provides medical assistance to the people in the countries that are currently facing with emergency situations such as health crisis, endemics, and wars. So now we already know what is actually MSF. So let's get into the background facts of MSF. MSF is founded in 1971 in Paris, France, by a group of doctors and journalists. And now it operates in more than 70 countries and is mostly funded by public donations. And who is the members of MSF? MSF includes doctors, nurses, and also logisticians that are ready to deliver healthcare when it is needed the most. Moving on to the vision and mission of MSF. As for the vision, MSF envisions a world where everyone has access towards medical care regardless of their race, religion, politics, or economic status. As for the vision, MSF provides impartial and independent medical healthcare to the people in need. So they want to put humanitarian needs first instead of politics and profits. Despite its success, MSF also faces with management challenges, and the challenges include unequal treatment between different staff groups. This can be proven by the unequal payment that they receive. Next, MSF also faces with unstable funding due to the reliance on public donations. Apart from that, MSF also faces with supply and chain problems due to the conflicts and also the high transportation costs. Lastly, MSF also faces problems regarding the accountability and misconduct in their reporting systems. Moving on to the importance of applying management principles. By applying the management principles, MSF can stay organized and effective. Apart from that, it also improves teamwork, maintains stability, and support adaptability during crisis. Lastly, it also helps to motivate staff and ensures accountability and transparency in all operations.
Hello, my name is Nasri and I am the management consultant at ANEI Consulting Groups. Today I will discuss about decision making in MSF. Before that, what is decision making? According to Stephen P. Robbins, decision making is the process of choosing the best course of action among alternatives. The main aim of this process is to help an organization achieve its goals in the most efficient and effective way possible. However, in MSF, the focus of decision making is quite different from profit-driven organization. Instead of aiming for financial gain, MSF decisions are centered around their humanitarian mission, providing medical care and support to people in crisis. Every choice made by MSF is focusing on mission and impact, not profit. Decision-making plays a crucial role in helping an organization stay on track with its mission and vision. Firstly, it ensures that every action taken align with the organization's core purpose. It helps guide, prioritize, set goals, and make sure that all efforts support what the organization truly stands for. For example, in MSF, strong decision-making allowed the organization to operate secret hospital in Syria during the war, ensuring they could continue saving life under extreme danger. This reflects how decision-making support their mission of providing medical care to people in need, no matter the circumstance. Secondly, decision-making is vital for the efficient use of limited resources. Non-profit organizations like MSF often face scarcity of funds, equipment, and manpower, so every decision must be made carefully to maximize effort. For instance, MSF must often decide which crisis zone should receive medical aid first, a difficult but necessary choice. Make sure help reaches those who need it most. Overall, effective decision-making helps MSF stay mission-focused and resource-efficient, ensuring that every action contributes meaningfully to their goals. Before we discuss the decision-making challenges of MSF, it's important to understand the background of Sudan War. The current war began in April 2023, when the Sudanese army and the RSF militia clashed over control of power. From 2023 to 2025, MSF has stayed in Sudan through danger and shortage, proving true dedicating to saving life. MSF's biggest challenge is deciding where, how, and whether to operate. In many cases, hospitals has been closed due to shelling or direct attacks. MSF must decide should they stay and risk staff life or withdraw or leave civilians without care. In Sudan crisis, MSF faces major challenges that affect their decisions and operations. They often have limited information because communication lines are down. There's also time pressure as MSF must act quickly to deliver aids and save life. With limited resources, tough decisions must be made about where to send staff and supplies. And finally, safety risks are constant. MSF works in areas with violence and insecurity. Even with these challenges, MSF continues to provide medical care and humanitarian support to those most in need. What is bounded rationality model? Bounded rationality means that when people make decisions, they do so under certain limits, such as limited time, information, or resources. In reality, it's impossible to evaluate every possible alternative perfectly, so instead of finding the best solution, people often settle for one that is good enough to meet the goal. This concept reminds us that decision-making is not always perfect logical, it's practical and based on real-world constraints. I choose the bounded rationality model because it best reflects how MSF can make decisions in real crisis situations like the Sudan conflict. In such environment, MSF doesn't have the luxury of full information, time, or resources. They must act fast using whatever data they have to make decisions that are good enough to save life, even the solution is not perfect. This model recognizes the real-world limits MSF faces, uncertainty, pressure, and risk, while still guiding them toward practical and effective action. That's why the bounded rationality model fits MSF humanitarian decision-making approach during the Sudan crisis. The bounded rationality model is suitable for MSF, especially during the Sudan crisis where decisions must be made quickly with limited information. First, MSF identifies the problem such as a sudden outbreak or lack of medical access. Then they set criteria for a satisfactory solution, for example, reaching as many patients as possible within safety limits. Next, they generate a few realistic alternatives like sending mobile clinics or partnering with local health workers. After that, MSF evaluates this option based on available staff, safety, and resources. Then, they choose a satisfying solution, one that is good enough to save life under current condition, even if the solution is not perfect. Finally, they implement and monitor the decision to adjust as the situation changes. This model helps MSF stay effective in complex, high-risk environment like Sudan, where perfect information and unlimited resources are impossible.
So today, I'm going to be talking about leadership in non-profit organizations, its impact, the issue that may arise, and a real-world case study that illustrates how leadership plays a crucial role in driving social change. So first of all, let's talk about the definition of non-profit leadership. Leadership in non-profit organization refers to management and guidance of a team toward a mission-driven goal, focusing on social impact rather than profit. According to Peter G. Northouse 2019, leadership in this context is the ability to influence, motivate, and enable others to contribute toward the effectiveness and success of the organization's mission. Next, let's move on to the impact of leadership. First of all, leadership provides a clear direction. Strong leaders are able to communicate the organization's mission and goals, ensuring that everyone understands the purpose of their work. This helps team members stay focused on shared objectives and reduce confusion in daily operations. Secondly, leadership plays a major role in motivating and inspiring people. In non-profit organizations, passions and purpose are powerful drivers. Leaders who demonstrate commitment to the mission and are able to spark the same level of dedication in others, encouraging creativity, initiative, and persistence, especially during challenging situations. However, leadership in non-profit organizations also comes with challenges. One major issue is promoting teamwork across diverse backgrounds. Organizations like Medicine Sans Frontières or MSF have teams made up of individuals from different nationalities, cultures, and professional experiences. These differences can lead to misunderstandings or conflicts, especially when communication styles or works ethics clash. For example, in South Sudan, MSF doctors and nurses from various countries struggle to work together effectively due to cultural and professional differences. This shows how important it is for leaders to foster inclusivity, understanding, and open communication among their own members. A helpful case study is the Alas Hanet Baldi Association for Sustainable Development in Egypt, also known as AYBSD. The organization adopted a leadership approach focused on vision, empowerment, innovation, and community engagement. Its leaders articulated a strong and inspiring vision for sustainable development. They empowered staff members and stakeholders, encouraging them to look beyond their immediate roles and contribute creatively to addressing poverty in local communities. This approach not only improved internal teamwork, but also strengthened the organization's impact on society. In conclusion, leadership in non-profit organizations is crucial for achieving mission-driven goals. While leaders inspire, motivate, and guide their teams, they must also address challenges related to diversity and communication. The example of AYBSD just now demonstrates how effective leadership can transform both people and communities. Thank you.
So now, let us get into management trends. But first, what is actually management trends? Management trends refer to the practices, approaches, and strategies that managers use to improve how an organization plans, organizes, leads, and also controls its activities. These trends are really important because the world is constantly changing. So, NGO especially must respond to the conflict, pandemic, and health crisis So they always need to keep on updating the ways on how they are working. So by following these management trends, organization can become more transparent, accountable, and efficient. It helps to strengthen donor trust and allows them to maximize their humanitarian impact, even with limited resources. Now, let's take a look at 3 major trends that are shaping MSF operations. The first trend is digital fundraising. Today, MSF is no longer depends only on traditional charity. Instead, they use online donation platforms such as mobile apps and social media campaigns to reach global donors. During crisis, these digital tools help MSF raise funds quickly and communicate real-time updates. Digital fundraising also attracts younger, tech-savvy donors and diversifies their funding sources. This is important because MSF needs rapid financial support during emergencies like flood, wars, or disease outbreaks. The second trend is virtual volunteers engagement. MSF now engages volunteers for online tasks such as translation, communication, and also administrative work. They use virtual meetings, online platforms, and also webinars to connect people from different countries. This allows everyone to participate remotely, especially when travel is being restricted, such as during COVID-19 pandemic. This also allows MSF to save costs, recruit more volunteers, and maintain their operation even in challenging situations. So the third trend is data-driven impact measurement. MSF collects data and digital records to track medical outcomes. For example, during the Ebola outbreak, data helped to improve patient care and coordination. By using data, MSF can make better decisions, be more transparent, and show donors the real evidence of impact. This builds stronger donor trust and improves accountability. In summary, management trends are crucial for non-profit organizations like MSF. Through digital fundraising, virtual volunteer engagement, and data-driven impact measurement, MSF can continue delivering effective humanitarian aid while adapting to global challenges.
Thank you, Iman, for explaining the definition of the management trend and also the key trend shaping the MSF. Challenge and risk that faced by MSF is one of it is the donor fatigue. It happens when people feel overwhelmed because of the increasing on the global crisis that never stop, and they will feel to be donate less, and this affect the MSF financially stability because they depend on public donation. One is cybersecurity concern. As MSF expanded and they're using more digital fundraising and patient data system, it becomes so vulnerable to hacking and data leaks. And this is dangerous because MSF handles sensitive medical and personal information on the patient. And if they be really leaked, the hacker will use this information for their advantage. Will be regulatory compliant. As MSF work in many different countries, which is over 70 countries, they must comply with many different legal requirements. And for example, how they register as NGO in that country, and also the taxation system in that country. This complicated operation can slow down the humanitarian response. After looking at the challenge and risk that faced by MSF, now I will explain how MSF can address these risks through practical steps that support innovation while compromising its core principle. One will be adopt a secure digital system, and MSF can do this by using more and high level of encrypted database in order to protect all of the data. This one will be a transparent communication. This is for maintaining the donor trust and also reducing the donor fatigue. MSF must continue providing a real-time update on usage fund and also project outcome by using verified online report. This one will be the continuous staff training. As technology evolve, the co-worker and staff need to update their skill in order to reduce the error and also improve the efficiency. In conclusion, MSF must strengthen its management system in order to achieve its humanitarian vision and mission. That's all from us. Thank you.